Hello, everyone. So we're going to go ahead and get things started, get things rolling today. So I'm Laura Rigg. I work for St. Elizabeth. I see a bunch of my crew out there. So let's just wave to them because I know those people. And just welcome to the Safety Net Alliance for May. Our topic's going to be healthcare, and you're going to see a lot of different people up here. I have a lot of questions, a lot of answers. It's going to be great. So here is our meeting agenda. So from right now to 1 o'clock, we talk about our mission and vision statements. We welcome first-time attenders, and we have our committee reports. From 1 to 1:45 is when we have our panel discussion, which is healthcare services. And then we're going to have a time for you guys to have questions and hopefully get them answered. 1:45 to 2, member announcements. Remember, we're not doing any fundraising. This is just member announcements. And then at 2 o'clock, we can get out of here. All right. None of that is what I'm supposed to be talking about. All right, so our mission and values. So the mission of Safety Net is to unite, strengthen, and amplify the collective impact of diverse organizations and individuals dedicating to change the lives of Northern Kentuckians facing diversity. So as we all know, that we're here together to get lots of information, to do lots of things, to network and to find ways that we have that safety net to make sure that all of the people that we work with get all of the help that they can. All right, so any first-time visitors? Raise your hand, we'll come around to get you. All right. All right, we're going to start over here, and we're going to work our way around.
Well, I'm not new, but I am new in this role.
All right.
My name is Delisa Tinsley. I am with NKCAC. I was a youth services case. I have since been promoted, I guess, to a connector. So I just wanted to come and let everyone in the room know that now I am no longer youth services case manager. I am a connector. And my region is Kenton County.
Excellent. Thank you. And you, all right. I'll get my steps in.
Hello, my name is Jessica Warner. I'm representing CVG Airport. I'm on the Human Resources team as the Workforce Development Program Manager. Thank you.
Excellent. All right, I saw one over here. Here we go.
Hi, I'm Rebecca Brown, and I'm here representing Hills Women's Health, and this is our lovely director, Bethany Vaughn.
Well, we only have one.
I'll run it. I got gym shoes on today. I dress
All right, you got
appropriately.
gym shoes. Okay.
Yes, I dress right today.
Hi everyone, I'm Amber Parks. I'm with Acadia Healthcare. I work as a treatment placement specialist helping clinicians, families navigate higher levels of care and where insurance is sending people because we all know that is the driver of care.
Welcome.
Thank you.
Awesome. And here, reach across.
Hello, my name is Tilwa Zachary. I am the Kentucky Coordinator Grandparents Program of Northern Kentucky. I do all 8 counties and I service grandparents. And
Who else is new?
I can do up here.
Perfect. Anyone back here? Awesome.
Hello, I am Sequoia Tolliver. I am the Enrollment and Engagement Specialist at Brighton Center.
Thank you.
I think that's everybody. I think that's all the new folks.
All right, all the new people. Thank you so much for coming. We love having new people here. Here, I'm going to steal that one. All right. So committee reports and projects. So we're going to change things up a little bit, and we're not going to go with all of the committee reports, just things that are new. Did you want to talk about the executive committee, what we're doing, or do you want me to?
I can do my best if you want to.
Okay. We're both on it. Let's fight. Here you go.
So the executive committee is trying to continue So instead of having to worry about 2,500 client files a month, maybe we can think creatively and find one of our niche programs that could be like 10. That would be a nice size for a beta, or 20, or something where we don't have to drink through the fire hose all at once. So if you could join Care Suite, that would be a big help to the executive committee. Second, funding. So we do have some funding, why we've been able to hire Jared and do the nice things we do here for the safety net. With that's a little bit of accountability. So one of the things that I think we can do to help Jared is if there are any big things that you or your agency have worked on, specifically if it's like policy-based, like I've talked about House Bill 904 that a lot of us champion for charitable gaming. I know the Children's Home, the DCCH, just got like a $3.7 million state allotment for the first time in 178 years. That came off a lot of safety net advocacy. We don't know those stories, so the executive committee's having a hard time because, as we've mentioned, we don't do a great job singing our own praises about how good the safety net work we do at our own agencies. It's going to be really helpful for Jared to be able to have some meat on the bone for our accountability to the funder that these are the public advocacy things that we've worked on. These are some state-based issues that our agency have faced and what the outcome was, but we can't give that narrative without you guys telling Jared. So we've realized that's important. So again, for your wins, like I promised to send Jared a narrative of what House Bill 904 was, how the safety net partners advocated, and how we use the external relations page to make sure like as many partners knew what we were asking them to do as possible. So again, any answers you guys would have for that, even if it's from your executive director or your development director, please, we want to start to get some like measurable, these are big things that the safety net was able to do that wasn't just talking about it. Okay. Am I missing any of the other asks that we need off of our meeting? Awesome, terrific. Any questions about the executive committee, please feel free to meet with Jared, me, reach out. We've kind of scattered around right now, so I know Kay can't be here today, but we will do the best to answer any questions that we can.
Thank you, Andy.
Thank you.
All right, so if you'll notice on your sign-in sheet, there's a QR code on the front with a little red tag that says new on it. So over the past few months, I've been asking a question on the sign-in sheet. Would you feel comfortable sharing your name, title, and organization and email on a member directory? So everyone who said yes, you'd have your contact information on this member directory. Some important points about it. It will not be available to the general public. My plan is to put this on a hidden page on our website that only members have access to. So as you look at it right now, don't share it with clients or with many other people. This is just your own little preview, and it will go on the website, and only you all will be able to access it. So more to come on that. I just wanted to show you a preview, show you how big our network is, and how it maybe encourage you all to work together, contact each other outside of this meeting. And then as far as the SNA 101 new member guide, that is something the Member Engagement Committee has been working on. It is kind of a how-to everything Safety Net Alliance. So what happens at our meetings, who the leadership is, how to send an alert, what the affinity groups are, what a committee is, how to join those committees, the history of the SNA, everything about us that a new member would want to know will be in this new member guide. It's just undergoing some final edits right now, and I'm hoping to send it out as an alert the first week of June. So just two big things to keep your eyes on. Watch out for that alert, but if you want to go ahead and start networking with folks and using that member directory, go ahead and do that. Just don't share it with other folks.
And a shout out to Jared for all of the hard work that he has done to put all of this stuff together. And if you haven't been to the Safety Net page recently, go to it. The calendar is excellent. Everything looks so, there's so many links, there's so many things, and that is all Jared's hard work. So, we need, give it up to Jared for all the hard work he's doing. It's amazing. All right, so we're going to go ahead with our healthcare panel discussion. So the first up, we have Stacy Wethington from Faith Community Health Network. Next, Taylor Zumwalt, the St. Elizabeth Director of Community Health and Partnership. We have Pamela Millay, Director of Clinical Services at NKY Health Department. Bethany Vaughn, who is the director of Hills Women's Health, and Biz Rowe, hospital response manager for the Ion Center. So go right ahead. There's steps right over here. Please watch your step. There's no handrails. I'm gonna help the pregnant lady. I'm gonna tell you, I will. I'll help. If anyone needs help, I can help them. It is dangerous. I'm gonna go steal another microphone real quick. All right, so first, I'm just gonna ask you guys to explain who you are, where you are, and a little bit of what you and your organization does.
Hi, I'm Stacy Wethington. I'm the clinic director for Faith Community Health Network. We have a pharmacy, and then we are getting ready to open a free clinic, hopefully in a few weeks. So we will provide health care to individuals who don't have insurance.
Hi, my name is Taylor Zumwald. I am the director of St. Elizabeth's Community Health and Partnership Department. So our department really focuses on engaging individuals who have been historically underserved by healthcare or are just less engaged than others. And we do that in a variety of ways. We partner with community partners like you all to provide programs in community. We have some community advisory councils we utilize. And then our main role is executing against the findings of our community needs health assessment that we do every 3 years at St. Elizabeth.
So, hi, I'm Pamela Millay. I work at the Northern Kentucky Health Department. I'm their Director of Clinical Services. The Health Department, generally speaking, has a lot of different things that we do. One of the things I think we're best known for is inspecting restaurants, but that's not what I do. I have 4 clinics in Boone, Kenton, Campbell, and Grant County. And in each of those clinics, we provide clinical services to individuals who don't have insurance. Now, we don't do primary care, so we're very excited about the Faith, not pharmacy, you call yourselves? Yeah, what she said. Anyway, so we're very excited to talk to them, and I've had a few meetings with them, actually, since they started this initiative. So, but we provide WIC, which is a nutrition, education, and supplement program, among other things. And we provide women's health. So we'll do your annual women's health exam and make sure you get a mammogram and even pay for that if you're uninsured. And we'll do cervical cancer screenings as part of that exam. And we will also provide birth control. So that's our family planning piece. And then immunizations. We do immunizations for children without insurance or with Medicaid, and for adults without insurance. We're one of the few places that can do that, and we're very excited. And I'm sure I'm forgetting something, but those are the big things. We also, as part of I have registered dietitians on staff who do medical nutrition therapy, and that is something I'm trying to grow. So if someone comes in for WIC or another service, and we find they need this service, we will refer them and get them an appointment for medical nutrition therapy. But those are the big things. I'm sure I forgot something. There you go.
Thank you. Good afternoon. My name is Bethany Vaughn. I am with Hills Women's Health, which is a medical mobile unit. It's actually a ministry outreach partnership with Seven Hills Church. We serve Northern Kentucky, we serve Ohio, and we've also had people come over from Indiana and meet us, like in the Hebron, Petersburg areas, and so tri-state area. And our mobile is generally out on Tuesdays and Thursdays. We serve abortion vulnerable women, but that encompasses really just scanning to confirm pregnancy from 6 weeks to 24 weeks. We offer free pregnancy tests, free ultrasounds, mentorship support, and then beyond that, we have established embrace groups through Seven Hills Church, which is single dad supports groups, single mom support groups, and then moms, women facing unplanned pregnancy, they receive a shower at the end of their support group. And so we just got done celebrating 4 moms, one has triplets, so 6
Oh, wow.
babies, just 2 weeks ago, and it was really, really special.
Excellent.
Hello, I am Biz Rowe. I am the hospital response manager for the ION Center for Violence Prevention, and I am dual contracted with the forensic department at St. Elizabeth Hospitals. The ION Center provides services to people in our community who are impacted by power-based personal violence, more specifically intimate partner violence and sexual violence. For my team itself at the hospital, we provide 24-hour, 7-day-a-week, 365 a year bedside advocacy for anyone who comes into the emergency room and discloses that they have been impacted by either intimate partner violence or sexual violence.
Thank you. Thank you guys so much for being here. So we'll go ahead with our questions. So what is driving the need for your services that the community, especially this nonprofit helping community, needs to be aware of? And whoever has the microphone can go ahead and start.
They're looking at me, so I guess I will begin. I would say that the driving force is just that we know that intimate partner violence and sexual violence is underreported in our communities. For Kentucky and the United States specifically, 1 in 3 women are impacted by intimate partner violence or domestic violence, and 1 in 6 men. And again, that's underreporting. And then nearly like 50% of women in the United States are impacted by sexual violence. And so I'd say the biggest drive is to kind of break those stigmas of violence for people without identities, gender identities, and for men. And then also just providing that trauma-informed care when it comes to individuals who are impacted by this violence.
I guess I got the other microphone, so I'll start. One of the things that, we're facing is any changes in Medicaid, and we've been told people are losing their Medicaid. And so I see us being there, providing some of our services for people without insurance growing. I don't have any statistics or numbers on that, but I'm hoping to do some analysis on that. The other thing is we have some new programs coming, and I didn't mention them before, but we just started treating hepatitis C. So that is a need in the community that has driven us to move in this direction. We're very excited about it. Our next step, and we started that this fiscal year, next fiscal year, we will start providing PrEP. So another service that individuals are having difficulty finding, I hope we can help them find that service. And then the last thing we're working on, and hopefully starting next fiscal year, is to provide prenatal services. For there are unfortunately a lot of women who do not get early prenatal care or prenatal care at all, and they end up in the hospital delivering without prenatal care. So my goal is to find those people and to serve them.
Excellent.
Sure. Yeah, so I think our biggest, one of the biggest things we've seen is just consistently an uptick in unexpected pregnancies with lack of support, right? And so a lot of moms, even if they're single or in a relationship, a lot of them, statistics show that like 73% choose not to have their baby because they feel the financial stressors, which is why we're all here, right, to meet that need. And then 74% say that they feel pressured by others in some way, and 48% voice like relational concerns and issues, maybe not feeling safe or supported at all. And so I think there's a lot of stressors at play, lack of support at play, but there's also just a deep relational, emotional gap there that my team, we just love to meet people where they're at, connect them, being that first connection point, giving them hope, giving them those free services, getting to see their baby for the first time, but then also connecting them to some of these amazing organizations in the community that are doing awesome work. And then again, like Pamela shared, I think that STI testing is where we're moving towards too. We've had recent walk-ons more and more recently. We just had a few last week of even gentlemen too, and wanting that STI testing. And so moving towards that direction and being able to offer that to them as well on the mobile.
I think there are a lot of different reasons why partnership matters more in healthcare than it has in previous times. One of which we've already kind of spoken about here, which is the fact that individuals have greater needs for social determinants of health than we've seen previously. And so healthcare, the access to quality healthcare matters, and we are really proud of the healthcare that we provide at St. Elizabeth. But we also know that 80% of health has nothing to do with whether or not you see your doctor. And so because of that, it's extremely important for us to understand that healthcare happens outside of the walls of a hospital or a doctor's office. And those partnerships become necessary so that we can reach all of our communities and be able to connect those dots for them, and that they can better care for themselves and their families. And I think that's really how we drive health outcomes over time.
I think one of the things that we're seeing is there's an increase in chronic health conditions like diabetes, hypertension, mental health challenges, and so people are delaying treatment because they cannot afford health care. And so by the time they get to see someone, they're in a pretty bad spot, and it's because they couldn't afford to get treatment. I think health literacy is also a big issue. It's hard to navigate all of the systems, and some of these people that they don't have the health literacy to navigate and to be able to help themselves and find the care and help that they need. So we're hoping to bridge that gap and be able to help them with some of those resources that they need. And I think also just the growing number of people who are working hard but just still cannot afford care.
Yeah, absolutely. I've always told all my patients that having a chronic condition is like having a full-time job on top of your full-time job. And people are getting chronic conditions at younger and younger and younger ages. And it's amazing how they're expected to work and still have life, to get insurance, to take care of themselves. It's a giant thing. So what are the primary challenges or barriers that you're currently hindering the effectiveness and impact of your guys' programs? We can start with the microphones. We'll work our way out.
I'll start. So we aren't open yet, but I can talk about some of the things that I think that we'll see. I think transportation is a big issue for our patients. So what we're trying to do is make sure that they get the whole care while they're with us. So they come in, they see a provider. We have a pretty robust point of care testing laboratory, so we can do a lot of the lab work that they need and the procedures that they need while they're there, instead of having them come back for lab results and things like that. So our goal is to have them kind of have the whole person care. They will get everything that they need. They'll walk downstairs and get their prescriptions before they leave. And that will hopefully take care of some of those barriers like transportation. We are faith-based, so we will also be giving them spiritual care while they're there, and offering services to help them with some of those social determinants of health, and also, if they're eligible, maybe help them get insurance and help them navigate that system. So.
Sure. Yeah, so I think, like, echoing what you said, just for us specifically too, it's just been awareness, that long-term support, being able to provide that, and then accessibility for them. Now that we're a medical mobile unit though, we have broken a lot of those barriers. I think the biggest thing is a lot of times we are appointment driven with our location, whether it's we're meeting them over in Cincinnati or in Northern Kentucky somewhere, just ramping up our connections in order to be able to park safely places, and have those high traffic areas to allow for walk-ons too at the same time. So continuing to move through that barrier. And then awareness too. So like these kind of things break that down, right? Because the more people know, I always am like, you take all your knowledge into your spheres of influence. We all have different spheres of influence, and so awareness is key for every single one of these amazing organizations here. And then long-term support, because we are seeing them on a mobile. We do several follow-ups, but then we really do try to push them to an organization that is able to provide them with that long-term support if it isn't into one of the support groups at our church. And so that's why you guys really come in and play a critical role too.
When I first started in this role, my department's only about 16, 18 months old. So when I first started, I don't remember who said this, and I wish I did because I've quoted it many, many times. So if there's anyone in this room, stop me at some point, please, and let me know so I can start giving you credit. But someone told me that Northern Kentucky is resource rich and coordination poor. And I have seen that over and over and over again in our role. We have no shortage of individuals who want to help. Truthfully, in the last 18 months, I have not been presented with a need that we could not find some kind of solution or someone willing to help. But the problem is the time, the effort, the relationships it takes to connect those dots. Mm-hmm. And so from our perspective, what we really see is just such a need for a more comprehensive network that doesn't necessarily rely on me knowing Pam at the health department and giving her a call, and really relies more on an easier form of access. Because when we're talking about our clients, the thing that they don't have in their time of crisis is time. They do not have time, and really they don't have the energy. Like you were saying earlier with chronic care, that's just one example of people that they don't have the time or the energy to put into building the relationships. And so we have to make that more accessible. And that's hard to keep up to date because we all know that the second you print your resource list, it's out of date immediately. And so figuring out a way to keep that much more up to date and much more accessible, I think is such an important piece that really would increase the effectiveness of all of our work.
Barriers and challenges are very similar to some of the things that everybody's talked about. Transportation is a huge barrier for a lot of individuals that we serve. Some of the things that we've done to help with that, our WIC program now has a mobile unit, and they will go out into the community and try to different locations, different events that some of you guys have held. We'll bring the unit, we'll sign people up for WIC, we'll meet them where they are. We call it WIC on Wheels, or WOW for short. Another thing is with the new hepatitis C treatment program, I have one NP who's providing the treatment for that program, and she's located at a certain health center while I have 3 others. So she travels on at least once a month to each of the other health centers to try to get closest to where the people are going already so that she can treat them. Another thing we do, and it's not in my department, but we have an HIV case management, and you talked about coordination, and one of the big things that they do is coordinate care. They provide transportation, they get people to their health care visits, and the goal of the program is to get people undetected and get them treated. So that is a big thing that the health department does, and not having transportation is a barrier. Not having insurance is a barrier, we all know that. We work with the CAC connectors to get insurance for people. The HIV folks have a broker that they work with to help get insurance for individuals who are living with HIV. It's very important that not everybody's going to be able to qualify for insurance, but if they can and we can get them insurance, we're going to work on that with them. But those are some of the barriers and challenges I have seen.
I think the biggest barriers for us are first going to be a lot like other nonprofit organizations where there are funding cuts and budget cuts, which lead to like staffing shortages as well as like lack of resources for specific niche topics like sexual violence or intimate partner violence for adults specifically, or teen dating violence for 14 to 18. And so when you are in strict guidelines of what services you can provide due to certain like grants that you're funded through, it does make it difficult to give services to survivors or victim survivors. Additionally, we have cultural barriers or past history barriers. So if someone has experienced a bad legal system experience from a previous intimate partner violence or a sexual violence, they're less likely to seek help in future or in current situations. And then I would say awareness, just to kind of play off of some of the things that my co-panelists have said, awareness and education. So ION Center has been around for 50 years, and there are still people in the community that when they ask me what I do and I say I work for the ION Center, they're like, what is that? We were formerly known as the Women's Crisis Center, and before that we were Kentucky Rape Crisis Center. So I think like the name change and not just, ION doesn't say a whole lot when you just say the ION Center. So getting that education out there, letting people know what resources we have, what services we provide to victim survivors, until we can get those out in the community and get kind of people to let us in and kind of give that education, there's always going to be that barrier.
Excellent, thank you. In your view, how can local organizations collaborate more strategically to address these unmet needs and drive sustainable solutions?
I'm starting again? Okay.
Yeah, go ahead.
So I would say that a lot of people, when it comes to intimate partner violence and sexual violence, have a presumption of what it is and what the dynamics are, but there is a lack of education in the different layers of what intimate partner violence or domestic violence or sexual violence is. And so I think a lot of people don't want us to come in and provide that education because it kind of gets blown off as like, well, I know what domestic violence is, I know what intimate partner violence is, I don't need any of that education. So just allowing someone to come and kind of provide things, because I have provided education to police officers who were like, oh, spousal rape is illegal, and I'm like, you should probably know that. And so just, providing that education, being willing to listen and open up and take like a new mindset into what those dynamics could be, even if you have a personal history or if you think that you know those dynamics. And then definitely collaboration and communication. I think that all of us are here, not because nonprofit is like a big money ticket, like we're not in it for the cash cow, but we are definitely here because we care about those individuals in our communities. And so just being willing to work alongside the people that are also burnt out and also struggling, also short-staffed, but knowing that we are client-centered or person-centered at the end of the day, and just making those meaningful connections and communication.
So I would, as far as collaboration and communication, I think it's key to everything that all of us do up here. I've met a lot of these individuals. I've worked with them before and will continue to do so. The health department, it's not just the clinics, it's our population health group, our HIV case management, our testing team who goes out and does the testing for hepatitis C and HIV, and then we try to link them to care, whether with us or with somebody else, wherever we can get them care. But additionally, I collaborate with St. Elizabeth's. My prenatal program will be collaborating with the Centers for Family Medicine. It's key to everything we do. What we are doing here today with the Safety Net Alliance and this group, it is collaboration and communication, and it's extremely important to everything all of us do.
Yeah, so good. I was like, I know ION Center walked through and supported a single mom in our sphere for like a whole year until she got back up on her feet. She had 4 kids, so it was really, really neat. And you guys are everywhere, too.
Yeah.
It is. So yes, I just think awareness. I think we have our information in the back to equip you guys. I think knowing that we serve the tri-state area, that we are mobile, so we can pull right up to your organization if you find out someone just recently discovered that they potentially could be pregnant and they're not sure, we can come confirm that. We can support them in that whole person approach. And so I think just knowing that, remembering that in your spheres of influence, and then also too knowing that whether they're in a relationship or not, going back to those statistics I shared, that 70% range, sometimes they're in a relationship and they feel really scared for their life and they might want that baby, but they're really scared, to stand up for themselves in that way. We just had a mom recently, and she left a 5-year relationship because he did not want her to move forward with the pregnancy, and she is doing incredible now, and is a whole different person. And she was like, I see so many things now looking back about that relationship, and she has her baby, and she's just a really wonderful mom. And so if we can support those initial steps in providing them what they need until they can get under a full care OB or at family community health network, I think that's key, is bridging those gaps, helping remove those barriers for them making that call, like you said, so you're able to build that relational bridge for them so they don't have to just call all these numbers on a page either. Like, have your team equipped to really help guide them in that moment is key.
That's why Care Suite's so important. Is right there, so they don't get that form fatigue. They don't have to keep signing things. They don't have to keep filling it out. We can send direct referrals. So again, talk to Jared if you want to be part of it.
And I think that is such a good example of what we can do to really improve this, because I think strategically we have to be willing to step outside of our own lanes and our own priorities to work together. So I've gotten the question a lot, because I'm a brand new department. People ask, like, well, why does St. Elizabeth have this department? And it's for this reason specifically, because this kind of coordination, that sort of strategic partnership, it doesn't happen without someone being able to drive that. And so I think it's really important for as organizations that we step up and really invest in developing that care coordination between organizations, and much further beyond just our walls and what we do specifically. I think the Safety Net Alliance is a really great example of that, and I think leveraging things like that to continue to build those networks is how we most strategically sustain the health that we're trying to improve.
I think pretty much everything's been said at this point. But, I think just realizing that none of us can do it alone and that we need one another for the different resources. I haven't been in this role for very long, but one thing I'm realizing is sometimes I'm inundated with the resources and different ways that we can help our patients, and just being able to put that together and actually turn it into something that when we have a patient in front of us, we know where to send them. And having follow-up on our end and making sure that they have been able to access the referrals that we've given them and the resources that we've given them. I think I have been overwhelmed by all of the different resources that are available, and just kind of going through them and figuring out what will work with us. So I think just realizing that we need one another.
Thank you so much. So we always like to kind of have a nice question to put in here. So can you share a recent impact that your organization has made to our community, or a success story within your organization or personal life? We'll just do the microphones. We'll go.
We'll go first. We're not open. We've obviously had really great stories come out of the pharmacy, and people who have received their medications who, were having chronic conditions and not having access to any of that. So those are all really great stories. I think for me and for the clinic, just being able to make these people feel seen, make them know that we are genuinely care about them and we care about their health and their spiritual well-being. My friend Amy always says there are no coincidences with Christ, and we have seen that in the clinic as we've built it, and all of the people that have come together and the different collaborations that we've had have really been truly amazing, and we've been surprised every time, but not surprised. So I think that's probably just a personal, making these people feel seen.
How did I get this? I'm just kidding. There's a lot of very positive things that come out of what we do. And something I hadn't mentioned yet is we test and screen and treat tuberculosis. And people believe that tuberculosis doesn't exist, but it does. And by reaching out, when we find a case, it's not just the case. It's like with any infectious disease. We do contact tracing, and we reach out and we get people tested, and we get people treated, and we get people cured. And if you find them when they're still latent, because you've got this active case and this other contact over here has latent. You can treat them and they'll never get to the point where they're really sick with active TB. And it's just one of those things that it's a very positive thing that we do, and you know, we can cure TB. It's curable, but it's got to be found and it's got to be tested and it's got to be treated, and then we got to treat all your family, because it's a whole family thing when you get exposed if you live with somebody with TB. So if we can catch you early when you're still latent, it's a very positive thing and positive outcome.
So I look at success in a couple different ways from the perspective of my role. And so we have some like tangible examples that are really stand out. So one would be, we partnered with the Esperanza Latino Center to provide diabetes management education to the Hispanic and Latino community, specifically in their language. So we were able to go there to provide those resources to empower them to be able to manage their health care in a way that they want to, but maybe don't necessarily have the resources that are culturally sensitive to do so. So that's kind of like a tangible takeaway, but truly the pieces of success that really stick with me are a little bit smaller, but in my opinion, much more meaningful. So those are things like when I go to a coffee shop, Una Taza in Covington, I always plug them. If you haven't been, you should go. It's delicious. Like when I go to that coffee shop and the owner comes from behind the counter and hugs me, or one of my associates talks to me about how she ran into one of her adopted class students and they sat and talked about Pokemon for 10 minutes just out and about on a Saturday. Those things to me indicate that we are building the community that we really want to see. And so, truthfully, while those things are really small, I genuinely believe that that is how we get any of the bigger things done, is when we have community like that. And so those are my favorite markers for success, even though they are a little bit smaller and don't show up on your metrics quite the same. So.
So good. So there's a few stories, and I think you have to focus on the one. You have to focus on the one person, right? Or else you can get swallowed up in all the hard and the work that we have to move towards, like moving that marker continuously towards. So I'm like, when I think back, I'm like, there's just so many ones. There's so many stories that stand out to me. Even just last week, a girl came on. The mobile was in Newport. The team was out just connecting in the area. They were in a busy traffic area. This girl walks up, asks them, hey, do you accept walk-ons? And they were able to give her an ultrasound. She wasn't connected to an OB. She had come over from Cincinnati and was just shopping in Newport. She ended up sharing with them that she was really 50-50 about her pregnancy. She was like, this was very unexpected. I don't know how I feel about it. And as soon as she got to see that confirmation and that baby moving on the screen, and we have such a warm, clean, hospitable environment on our mobile, it's really awesome. And then with the team, she just was like, I can do this. That's what she was like, I can do this. And so, and then they were able to really equip her with some resources in Cincinnati to help support her moving forward. And so building that relational bridge again. There's another story. We were over near NKU and a mom walked on, and her and her husband walk on. She was pregnant with her 7th. She had walked through some loss. The team was out, including Amy Barnes, who's on the board for Family Community Health Network that day. They were able to provide her an ultrasound. I think she was pretty early, 6-7 weeks. So they were able to confirm that for her, and then shared with her that Family Community Health Network is launching in a month, and her whole family would be able to have free insurance. And she was just in tears. Her husband had just stepped away from a job. He felt called to start his own practice, and so they were without insurance for an interim, and she is now going to be able to get long-term care and OB support long-term through this pregnancy. So it's just really beautiful, that relational bridge. And then through our Embrace Grace support groups too at Seven Hills, we send a lot of women and single dads through that support group, and they found a lot of community, a lot of hope, a lot of long-term best friends that they get to do motherhood and walk through life with. So it's really awesome.
So the ION Center has a bunch of different services, and they are departmentalized. So kind of like Taylor said, it would depend on like what manager you're talking to and what department on your definition of success. So I'll speak specifically for the team I supervise, which is the hospital response team. So instead of putting out like an individual's like story, because there are a ton of them, I'll just say that if you've ever experienced a sexual assault forensic exam or a DOVE exam for domestic violence, they are extremely high risk of re-traumatization and re-triggering. They are hard. They can take up to 7 or 8 hours. There's tons of pictures. There's a lot of different community partners involved, including law enforcement, hospital social workers, sexual assault nurse examiners, medical staff, the doctors there in the ER. And then you add an advocate into it. Then sometimes you add family dynamics, such as husband or boyfriend, girlfriend, wife. Children are sometimes in the hospital room with a mom that is getting care for a domestic violence situation. So there are a lot of different pieces at play. So for me, I think any time that we get to the end of an exam and you can kind of see that empowerment of that victim survivor and kind of tell that they're ready for that healing journey, that feels like a success to me. So anytime that they're able to say, like, I appreciate you being here for me, thank you so much, or they're taking down our services and they're taking our packet with them and they're saying, like, what time can I reach out again? Anytime that you see that little, like, spark of, like, okay, this person was definitely impacted by me being here, I can go home and it makes sleeping just a little bit easier. You know, it's still a little hard, but definitely just being able to see that empowered victim survivor definitely means something.
Thank you. Thank you guys for sharing. Any questions for our panel?
That would have been nice. So my question is for St. Elizabeth and Faith Community Health. What is your organization's commitment, if there is any, to LGBT care, specifically with HIV prevention and HIV care?
Well, I'm glad we started off with a softball question. Thanks so much. No, I'm just kidding. Truthfully, from our perspective, what is most important when it comes to community health and partnerships is that everyone has access to the level of care that they need at that moment, and it doesn't matter what community you come from. We want to make sure you have the appropriate level of care. That being said, it does matter the community you come from because there are barriers associated with different communities. And so our focus from my department's perspective is reducing those barriers and making sure that individuals know that St. Elizabeth is for everyone. We are here to help everyone in the community. We are not here to help certain demographics or certain individuals. Our goal is truly to be a source for the entire community and create pathways that address the barriers that sometimes are that those populations may see.
I would echo her comments as well. Like I said, we are literally building this from the ground up right now, so these are great questions to hear and to think about. But as I said before, our main mission is to love people with dignity and provide health care with dignity, and that will include everyone.
Will you specialize in HIV care? Like, I want to know if I should send people.
Again, I don't know that that's something that we've fully thought through. Our focus initially will be primary care. We hope to expand into lots of other specialties. We do have some resources that the health department has provided. So we do have the HIV self-tests in our clinic. So again, another thing that we will definitely think about. Thank you for asking that.
I have a little bit of a follow-up to answer your second question. So we have several different training programs that we are implementing throughout St. Elizabeth where doctors, providers, nurses, anybody within our system can self-elect to get specific trainings and get certified, like through allyship training. So we have some allyship. Because I'm blanking right now, neurodivergency is another one. Veteran, thank you. Sorry guys, I'm pregnant and I really am just forgetting a lot of things right now. I would love to give you a better excuse than that, but it's all I got. But yes, so we do have doctors and individuals that have specifically said, I want to know more about this and I want to make sure that I can provide affirming care to the best of our ability. So we do have individuals that we are working on figuring out what's the best way to get those individuals recognized so that patients then have that option as well. But that's definitely something we're working on. But I do want to emphasize that we're doing things like that to make sure that all of our patients have a safe place to come for care. Okay.
For the health department, do you offer TB testing for free employment? If so, is it a skin test or risk assessment? And is there a cost?
So we can provide both. There is a cost. A lot of times, if you have a PCP, you can get it through insurance. Since we don't bill regular insurance, we can't bill for the service. But there is a cost, and it's a flat rate. And if you ask me what it is, I can't tell you. But what?
Are you pregnant too?
No. No. That ship has sailed. But yeah, we do both skin tests if that's a requirement of your employer, and we do screenings. Because a lot of times the skin test isn't needed. If you do the risk assessment, you don't have to do the TB skin test. And I think employers are finally getting that. Healthcare employers have gotten that a little while ago because there was a change in the law. But yeah, we do both.